Hi. Runner's knee is one of the most common injuries we see in the physio clinic. So let's talk about what it actually is. So I'll give you some definitions so that you know if runner's knee is what you've actually got. We'll talk about how to avoid it, although that's a pretty massive topic in itself. So I might create a couple of links below to videos more on what you can do to avoid getting runner's knee in the first place. The focus of our attention today is going to be more on what you can do to cure your runner's knee if you've already got some knee pain. So let's start by diving into a definition. Let's talk about what runner's knee actually is. So runner's knee is a fairly generic term for about 5 or 6 things that can go on somewhere through the front of your knee. So it's caused primarily by overusing your lateral quads, so the outside part of your quads here. And a lot of that's just due to life, due to sitting in chairs and spending our lives too much in a sitting position and overusing our hip flexors, underusing our glutes, and just, like I said, overusing these lateral quads. So by overusing these, it can cause a number of different things to happen through the front of your knee. So you can get something called patellar tendonitis, which is pain below your kneecap, and it's a little cord that joins your kneecap onto your shin bone. That can become sore and inflamed. On each side of the patellar tendon, there's something called Hoffer's fat pad, and that can become quite painful and inflamed. So sometimes people experience their pain here, sometimes people experience it more on the inside. You can get pain directly underneath your kneecap, so that's called retropatellar pain, and that tends to be a sharp catching pain when you're walking downstairs, so it can be under the kneecap. You can actually get one above your kneecap, a quads tendonitis, which is a little bit, that's less frequent, so that doesn't happen very often. And you can get ITB friction syndrome. So that's where the pain is right on the lateral border of your knee. That tends to feel a bit more like a sharp stabbing pain. So all of those things, patellar tendonitis, fat pad inflammation, retropatellar pain, quads tendonitis, and ITB friction syndrome they fall under that umbrella term of runner's knee, and they're primarily due to overusing this lateral quad muscle. Now, the standard physiotherapy or medical way of treating this is telling people to strengthen their VMO. So people get told to focus on really making this muscle strong. And that can be with machines in the gym. It can be just doing static contractions. It can be squats and lunges and things. And I think for a static population or a population of people who doesn't do much exercise, I think that potentially is a good approach, because the idea is if you strengthen this muscle, you're pulling your kneecap this way and changing the loading on all of those structures. So therefore, you're going to be less likely to cause the pain and inflammation. But in my opinion, runners are already overusing stuff. The reason runner's knee is an overuse condition, and it's caused by primarily overusing this muscle, not necessarily underusing this muscle. So my focus is always initially on improving flexibility and reducing tension through the lateral quads. So through foam rolling and through a couple of stretching techniques. So let me show you what I think you should do in order to the quickest way that you can get rid of those symptoms of runner's knee. So the most effective exercise you can do to help reduce the tension in your knee that causes the runner's knee symptoms is foam rolling your quads. Now, the most important thing with the foam rolling is to make sure you get the outside of your quads, which is the bit that's creating all the tension, which is probably creating the runner's knee. You can start on the outside of your leg, so start right on the outside of your leg, roll all the way over to the front and then back again a few times. And don't avoid this outside part. It's the bit that usually hurts the most, so unfortunately it ends up being the bit that most people try to avoid, or at best they may stay on it for 20 or 30 seconds. You should really be trying to foam roll for 3 or 4 minutes, even longer if you can. So starting on your side, rolling up and down, trying to find the sore bits, over onto that outside part, which really does hurt the most, all the way over to the front, If you've got a long foam roller like the one I'm using now, you can just keep on going over to the other leg and then just keep on going backwards and forwards. If you've got a short foam roller, you'll have to do one leg and then do the other leg. But really try not to shy away from that lateral border. And it is definitely where most of the pain is. When you're foam rolling, make sure you don't go over your knee, so don't go over the outside of your knee, especially if you've got the ITB friction syndrome, because that can actually make it even crankier because it's already a bit inflamed and you're going to inflame it more by rubbing over the bone. There's also a bony part on the outside of your hip, so don't go over that. So you're basically staying on the chunk of thigh in between. So in between your knee, so 3 or 4 centimeters above your knee, and just not over that hip bone. And remember to try and do it for 3 or 4 minutes or even longer. So my favorite stretch for runner's knee is this one. So it's what we call hunter-gatherer squat. So you squat down on your haunches. My ankles aren't flexible enough for my heels to touch the ground, and most people's won't be. So you're probably going to need to do this on your toes, not on flat feet. So if I'm on flat feet, I feel like I'm going to fall backwards. So up on the balls of my feet, squatting right down, and that stretches your lower back, your hips. If you prise your knees apart, you can get a bit of a groin stretch, but the position also stretches all those attachments in and around your knee. So it helps create more flexibility in through your knees. If your knees are really cranky and they're really inflamed and have been quite sore, you might not be able to get right into this position, in which case you could sort of modify it by doing a kneel. So kneeling down and then just gradually letting your bum sink towards your heels until you feel like you're getting a good stretch, probably mostly in your quads. But not, and you might feel some tension or some stretching in your knees, but not the knee pain, so it shouldn't hurt your knees. And then as you improve, you can just start kneeling lower and lower. Once that becomes comfortable, you should be able to get yourself into that hunter-gatherer squat position. So the third thing I think you should do to help with your runner's knee symptoms are if your pain is in this area underneath the kneecap, so either the patella tendon or the fat pads that we talked about earlier, then you should get some sort of massage cream. So that can be like a Voltaren gel or something like that, or it can be like a natural one. This is just Sorbolene that we use in the physio clinic. Get in there with your thumb. This is pretty counterintuitive because if your knee's cranky, this can be a bit painful. But get in there with your thumb and massage through all that front bit of your knee. So including the fat pads, if they're inflamed, this is allowed to be sore. You could put up with like a 4 or 5 out of 10 pain whilst you're doing the massage. Now it's important also that your quads are switched off. So if your quads are really tense, if your leg's tensed up, you can't actually get into that soft tissue down through there. So your quads have to be relaxed, which then means that your kneecap can move from side to side. And if your kneecap can move from side to side, then all this tissue relaxes and you can get in there with your thumb. So give that a good massage for 4 or 5 minutes. This is relevant for the patella tendonitis and the fat pad inflammation, not for the ITB friction syndrome. It can also be useful for the retropatellar pain, but mostly for those first 3 things that we discussed. So get used to giving it a good massage. So the best ways to avoid getting runner's knee are to not sit down as much at work. So if it's a possibility to get a standing desk at work, that can reduce your sitting time. That can be massively beneficial. Making sure that your glutes work properly. So you need to be able to get your glutes to contract really well without overusing your quad muscles. Running with good technique is vital. So making sure that you're not overstriding and that your foot's landing fairly close to under you. That can be a big help for runner's knee as well. And as is just improving your general hip and pelvis stability. If your balance on one foot isn't good and your pelvis rocks and twists from side to side, then that ends up traveling down the chain and putting more stress on your knee. So those are 4 things that you should take into account when you're trying to avoid getting runner's knee in the first place. Okay, so those are my favorite tips and tricks for curing your runner's knee pain. Foam rolling your quads, hunter-gatherer squat, massaging your knee, and ideally doing them every day.